The Eastern Cape government says it's making headway to manage the COVID-19 pandemic. It follows reports that coronavirus patients will be sent to neighbouring provinces. It says plans are afoot to refurbish facilities. The province is also celebrating a donation of 50 ventilators by the American government. We're joined by the Eastern Cape Premier's spokesperson, Mvusiwekhaya Sicwetsha. Good evening, and thank you so much for your time, sir. Firstly, talk to us about these reports that the Eastern Cape will now be relying on other provinces to help treat patients who are suffering from COVID-19. All right. Unfortunately, I'm not hearing you at all. We're going to have to try and re-establish connection with Mvusiwekhaya. For now, let's take a look at this. The KwaZulu-Natal Education Department has suspended 2 teachers from Umlazi Comprehensive Technical High School. It follows allegations that the 2 were having a love affair with a pupil. It's alleged that one of the teachers was caught by another kissing the pupil in the library toilet. The learner in question also confirmed that she had a relationship with not 1 but 2 teachers at the same school. Meanwhile, the provincial department has condemned the incident, saying it has a zero-tolerance approach to teachers abusing their profession by taking advantage of pupils. All right, let's turn our attention back to the Eastern Cape and get the response of the Premier spokesperson, Mvusiwekhaya Sicwetscha, who of course speaks on behalf of the province. Mvusiwekhaya, good evening. My question to you was around the reports that the Eastern Cape is going to be relying on other provinces. This is to help treat COVID-19 positive patients.
Good evening, Cathy. Thanks for having me. Look, I think the unfortunate part about the Times Live story is that it distorts and fabricates the information we have given them. What we have decided to do is to work with provinces that are closer to boundaries of our province, where there are people who are residing in those areas. Let me give you an example. If a person stays closer to the KZN border and that person requires emergency medical attention, and the hospital from the hospital is less than 50 kilometers, we rather transport that patient to the nearby hospital. We're doing this not because we are incompetent or our system has failed. We're doing it to ensure that more people access emergency health care closer to their homes, because this is something that provinces do. But or research, we always work together where there are communities closer to our borders, where they can access services from government. We always assist each other. So the misinformation that is in the Sunday Times story, which was a ham-fisted falsification of our information.
So what does this mean for provinces such as the Western Cape and KZN, both of which are still very much in the eye of the storm where COVID-19 infections are concerned? What kind of collaboration are you talking about with them? And does this mean that the Eastern Cape will be sharing some of its resources with those provinces to ensure that there isn't an unfair burden?
We work together all the time. You're talking about Western Cape. We've got communities that are closer to Western Cape boundaries. And those communities, those health facilities and South African police in those communities, they work together, whether with the Western Cape or in the Eastern Cape. So what it means is in cases where there's an emergency case and there's a closer hospital in another province, we'll transport people there. What it means is the health services of our country are for everyone. They are not for people according to their regions or villages. We do this all the time with other provinces. It is nothing new. We're specifying it now. We services during COVID, and one of the things that we are doing is to source oxygen for hospitals closer to these borders or to these other provinces. from them, because it is far, for instance, for a hospital in Lusikisiki to get oxygen from Port Elizabeth. So we want to make sure that we speed provision of health resources to help our people get relief when they need it. This is done to save lives than to suggest that we don't have capacity. We have capacity as the province, and we continue healthcare. 80% now recovering from COVID infections. We continue working with social partners to capacitate the health system, because there is no health system in the world that was ready for COVID. There is none that is able to deliver on its own. That's why you need support from your social partner, national government.
Mvusiwekhaya, we're going to have to leave it there for tonight.